you've been told that you have degeneration or arthritis in your lower back, I have a few tips for you. Hey everybody, Dr. Keith here. Hope you have an amazing day. The number one tip is that it's something that can be helped. Just because you have degeneration or arthritis in any area, but especially in your lower back, it doesn't mean that it's just going to keep getting worse and worse. You can make changes to help improve it, and depending on the degree of the severity of it, you may even be able to improve it, back to almost normal or normal. So a couple simple things to start with at home are a couple different stretches to help relieve some tension in that area and get some movement that you're probably not getting in the area. And when we don't have the specific movements we're going to be doing, it's a really common cause of arthritis or degeneration in those areas. And so what we're going to do is I'm going to have you do a couple simple stretches. And the first one, you're just going to get like this, and you're going to extend your back, and then you're going to come back up. And you're just going to kind of keep doing this. If it's painful, just don't go as far. You might even just go a little bit, but you want to try to go as far as you can every time. Hold it for a second, come on back up, and kind of go back down. And this will really help start to work this area here to where you're probably having a lot of that arthritis or degeneration. The other one is more you're going to hold the pose, but you're going to get the spine in a similar position. So you're just going to get into this pose and kind of hold it here. You can even watch TV for it. I would just start out by doing this for about 30 seconds. Then you can slowly increase. You can do this up to like a complete episode of a show that you're watching. It was very common that we have people do that once they're comfortable in doing it, because it'll really help those areas in the back. And so if you do have any arthritis or degeneration going on, I would give those a shot. It's not going to fix it overnight, because it is something that didn't happen overnight for you. It probably took years to kind of do, so it will take a while to get back to the condition that you're searching for. But the pain can even sometimes go away relatively quick when you start these. But even if the pain goes away, I would suggest keep continuing using these stretches. And if you need some other ones, just always let me know. There are more advanced ones, but these are some ones that will be really good for you to start with. So if you have any other questions, feel free to always ask. I'm Dr. Keith. Choose to be amazing.